Good evening to everyone. We have about 9 minutes before we will start. I am going to place in the chat all of the information that is needed. You need to type your name, your campus in the chat. And once we finish up tonight or at some point, make sure that you complete your attestation in your assigned class and include my name and today's date. So make sure you do that because they still want us. That still will count towards your attendance. Be sure to place your name and your campus in the chat. And then at some point, make sure you complete your attestation for this week in your assigned class. Include my name, which is Professor Morton Ford, and today's date in the body of your information that you're turning in. We still have about 8 minutes, but you all can go ahead and start putting your name and your campus in the chat. That way that will be out of the way. We have 4 minutes. We have 3 minutes until start time. Good evening, good evening. Good evening to everyone. Good evening. I'm hoping everyone is doing well. It is 8 o'clock and we will get started. As a reminder, make sure your camera's on and place your name and your campus and your professor's name in the chat. So make sure you type your name, your campus, and your professor's name in the chat. And as a reminder, these sessions are recorded. Make sure you turn your cameras on. And at the end of the session tonight and or before the week is over or weekend, because we only have one more day, make sure you complete your attestation in your assigned class. And in the body of that, make sure you place today's date and then my name, Professor Morton Ford. I placed all of what I just said in the chat. So, all right, so we'll go ahead and get started. You all were giving a PowerPoint, the HESI review PowerPoint. So that is what we will go by. And I'm going to share my screen. I'm just going to talk through it. Feel free to come in and add your points, ask your questions. Okay. All right. So community health. So remember, for community health, we are dealing with the same patient, the same person, but just in a different setting. Our goal is to take care of the persons in a non-acute setting. They're either in their home, they're at the community center, they're at the church, you're at the workplace. So things are not as acute, but we are still taking care of the same persons that have those disease processes that they had when they were at the urgent care center, when they were at the hospital. So the only thing that's changed is the setting, and things are more stable. We want to provide that encouragement to live healthier, make those healthier choices, provide that education and that information so that the environments have been assessed, so that that they are not in danger in their working environment or either their home environment. And so when you're that community health nurse, you know, you're working pretty much solo. You're seeking out those resources to put together, to make available, to make the person aware of, but hey, these things are available. So community health nursing, you're like that case manager, you're that go-to person. You are the go-between, several nicknames, but you're that person. So this slide says community health nursing, directed, goal-oriented, adaptable to the needs of the individual, the family, and the community during health and illness. An area of human services directed toward it, developing and enhancing health capabilities. Let's see, community health nurse focus on the community, what we had just said. All right, so public health nursing, it's been the go-to. Everybody at the public health, either they're going to acute, they come back to you, or either they're with you and then you're the one that send them off to acute. So you're that little foundation. So we're there to prevent the disease. In the event that a disease occur, we are there to help them manage the disease by promoting health and efficiency. So data collection and data interpretation. The primary goal of data collection is to get that usable information about the community and its health. So we can go in with an idea about something, but if it's not what's needed by the community or those persons, what good is it to anyone? It's a systematic collection of data about the community health. It requires gathering and compiling existing data, generating missing data. You know, it may be just some things that they haven't thought about. The information is there, but no one has put it together. And then interpreting that data. What does this mean? You know, why are we seeing all the people that's coming from this side of town that has a certain factory there? Why are they coming from? Why are they all experiencing the same symptoms? Why is it that everyone that went to this restaurant on this particular day and time, all of them are showing up at the ER with this type of these symptoms? So interpreting that data and seeing what can we do about it, identifying community health problems and communities' abilities. Some examples of data generation include information about the community's values, their beliefs, their social norms. Data gathering is a process of collecting the information that exists. So the age of the residents, the economic status, the racial distribution. So data gathering is the process of obtaining existing readily available data. Like we just said, the age of the person, the residents that are there, the racial distributions, the socioeconomic status. Feel free to jump in and ask questions now, you all. So when you take the HESI, remember, let me just stop here. When we take the HESI, you are compiling everything that you know. Remember, you have all of these file cabinets. I mean, and they are just jam-packed with information. The information is there. So you're dealing with the same patients that you talked about in med-surg, your same patients that you talked about in pediatrics, but they're just at home. They're at the workplace. They're at the community center. So it's the same information. It's just a community health HESI. You're just in a different setting. So it's not like.
Question.
Mm-hmm.
I have a study guide that you sent for us to download, and it's like 60 some pages long, and this is not. So when did you send this PowerPoint? I didn't get that one.
The study guide was sent out, I think probably in week 3, But this PowerPoint was sent,
Yeah,
say, last week, yes.
I
But if
have the
you have,
study guide.
go
I
ahead.
just don't know where the PowerPoint is.
Okay, so if you don't, if you can't find it in the announcements, I can just resend it to you.
Oh, what week was it sent out on?
This past
Yeah.
week it was with
Oh, okay.
Professor, because this is actually Professor's Marble. We sent it out when she did her review. When you sent her, no, Apple, this is Professor Apple. When we sent her link out,
Okay.
yes, it was an attachment in there.
Okay.
Mhm.
I don't have that PowerPoint either. We have something different. I see in all the professors they've been doing the HESI review with different PowerPoints, but I'm just wondering if we have access to them because we have different PowerPoint.
Okay, I found this on the web for review with different power.
Okay.
What were you saying? I don't hear you.
Oh, I was saying that we have, I mean, all the reviews, I watched 3 reviews and all the professors have different reviews that the one you guys sent us. So I just wondered if we can have those PowerPoints to review also.
This is the same PowerPoint that the other professors have used. It may just be looking different on the screen. But this is
So it's different content, what we have too.
okay.
I
And
think what she's saying is, excuse me, I think what she's saying is, if I'm correct, the other teachers, they're going over, like for the HESI review, they're going over the one in week 3, and they're going through the pages of all of those from what I saw. I didn't really see, from my knowledge, I didn't see the PowerPoint. I saw the thick package of like 60 something pages or so. They all are talking about that and breaking like the different areas up in chunks on that, but not this. And I think maybe that's what people are talking about.
so this
Yeah.
information and the study guide, this is first of all, it's not any new information, you all. This is the same information that we've been going over through the entire quarter. And the study guide is a compilation of, if you look at it, it's all the study guides that you have received throughout the semester. And so that's why it's so long. So it's nothing new, but this.
Oh, no. I'm just looking for the PowerPoint that you're showing so I can
Yes.
follow along. I have the study guide. I'm fine.
Okay, but I can share this, PowerPoint again.
Oh, thank you. I would like to do.
No problem. We can share it. So tonight, when the video is converted, when I send the link, I'll send this also to the other professors and saying, hey, they're requesting this PowerPoint. So when they upload it to your classroom, because I know everybody's in different courses, so it'll be the link to the review and this PowerPoint.
Thank you.
Thank you, because I'm not finding the PowerPoint. I click on everybody's reviews and there's no PowerPoint to click on, so.
Okay.
Okay, thank you.
And just remember, you all, this is not any new information, so don't think it's new information. Remember, yes, and remember your HESI is a compilation of your Peds, your med-surg, your OB. These are the same patients that you've been taking care of. It's just the setting is different. So, all right. So the healthcare delivery system, we can't get away from the different levels of prevention. Primary. So don't get caught off guard by the wording. So when we talk about primary intervention, what would you describe that? Tell me, how would you describe primary interventions? Not specifically give me an example of one, but if you were given a definition, what would you tell someone primary prevention is?
Teaching.
It will be the teaching without the patient actually we will be teaching how they say to prevent, to do a promotion without having a population that is already sick or have the illness or the risk.
Anyone else? You're telling someone, you're teaching someone, hey, primary prevention is, what would you tell them?
It's a prevention of the risk.
Okay, anyone else?
I think it depends also on what topic we're gonna talk about to the patient.
So
Like Like in some cases, it could be like teaching. Sometimes it could be like promoting something to be healthier.
Okay, so when you are selecting, when it's saying, hey, select a primary intervention, go back to what you know primary prevention is. You know, you say you're providing that education, you're promoting awareness about something. I think it was Rita said, there is no disease process. So when you're making those selections, when the question say, hey, select a primary prevention, because remember the interventions are going to be specific about something. So don't get caught off guard or get mixed up when, you know, because they're adding, you know, a disease process or they're adding a scenario is what I really want to say, a scenario. Don't get it mixed up. But if they are saying in the scenario, they are saying the answer choices are saying select a tertiary prevention. The answer choices are, no, select a primary prevention. We're talking about primary. Let me stay where we're at. And we have 3 answer choices. 2 answer choices are saying a client that has diabetes, we're providing education about the insulin pump. The second answer choice is a client with diabetes, we are providing education about metformin. And then the third answer choice is a group at the community center are being taught about diabetes. Which one is primary prevention?
The community.
Say that
The
again.
last option you said.
The last one. And also, if you were a little unsure or were just trying to get your thoughts together, the first 2, were they the exact same answer choices? Or were they different?
Tertiary prevention.
They both said the same thing. Both of the patients had diabetes. So make sure you're reading your answer choices. Even if you're having trouble with trying to select an answer choice, and this is just a test taking strategy, if your answer choices, if they look like they're the exact same thing, they probably are. And if your answer choice, your question is asking you to select only one answer, then you could automatically eliminate those 2 answer choices because they're both saying the same thing. Now, if it's saying select all that apply, then that's different. So yes, primary prevention, what you all said, there is not a disease process going on. We're talking about, we're informing, we're promoting, we're providing it education. So be sure that you're looking at those. So secondary, if you were explaining to someone about secondary prevention, you were just telling them, you know, what those interventions would look like. What would you say? What would be the whole purpose of a secondary intervention?
And screenings and tests. It could be to prevent, well, kind of to make sure you don't have something, or just testing. I mean, maybe it's testing for breast cancer, or like, you know, having them test for, I don't know. I just always remember it as prevent, and primary is preventing, and then secondary is like testing and all of those things. So mainly I just think of it as tests.
Okay, someone else, secondary. So yes,
I
you're right.
think she pretty much did a screening. So like if a person does have diabetes, screening, like glucose screenings.
So you are detecting, you're that detective, you're screening, you're trying to find out if something is there. You're trying to find out. So it could be that TB skin test. It could be that colonoscopy. It could be that mammogram. Yes, you're detecting, trying to see if there is something there. Good. Okay, and then tertiary management. So what would we tell someone those interventions are about?
More so doing like if someone has already been diagnosed with HIV, giving them teaching on safe methods on how to use condoms, or even trying to get them in a support group so that they can learn how to manage their diagnosis.
Okay, anyone else? Tertiary management?
Well, in tertiary, we want to see treatments, but we can educate patient how to use the glucometer, of how to take blood sugars. Or patient with asthma, we can ask them, help them to find out the triggers for their asthma. So it can be reducing the hospitalizations.
Okay. Anyone else?
I would say ensuring the quality of life after they already have the disease or illness. So just educating them.
Good. So the main thing is there is a disease process or a problem. There's a broken hip. There is something. There's obesity is already there. Diabetes is already there. There's a disease process or a problem. And you are still providing that education. You're trying to preserve that disease, that, you don't want the disease process to progress. So you're trying to maintain them so they can have the best quality of life. You want to prevent that exacerbation or that disease from getting any worse. They have that broken hip. You want that hip to get better so that that bone is mended and is better. So there is a disease or a problem that is already there. So the answer choices are saying a person with a broken hip, a person with, diabetes, and those are tertiary interventions. But if the intervention does not list a disease process or a problem that's there, is not tertiary. Good. So this little visual here is just showing free clinic, cook bill, free eye exams. So the persons, they may already have glaucoma and they're just going back just to see if the medication is, getting any better. This is just a visual here. Okay. So remember, we're promoting health. We're trying to preserve health. We're trying to improve health. That's our overarching goal, the process of enabling people to increase control of their health. We want to empower people by giving them the education, identifying those resources that are available. Identifying a resource that's not available, that really doesn't do the person any good. But so when you're out in the community, even if you have to go over like a community over, they providing those resources that are available, so that person can, help take control of their life, their health. So we, as community health nurses, we have to assess their environment. So when we're going into the homes, if they're having, programs at the church, or they're having programs at the community center, we need to assess, what is the environment like? They're going and sitting and spending their time. If they're at home, this is where they spend most of their time. What are those environmental things that put them at risk? So when we go in, we have to still ask those questions and look, show me, your, the bathroom, do we have those bars and things? If it's an elderly person, do we have the bars, the raised toilets? What's the age of the home? Because we do know homes built before 1978 paint was used that had lead in them. So doing that environmental assessment, it helps. Is it well ventilated? Do they have the smoke detectors? There are different programs and resources out there to obtain, the smoke detectors and the carbon monoxide detectors. This was in the last couple of years, this has been a big thing. And another thing is weather radios, especially the communities that are deemed to be those high prone storm areas like Tornado Alley. There was a big push to get people weather radios because, even though the forecasters were saying, hey, we believe this storm is coming, those tornadoes and things happen at the drop. You really don't have time to really just get anything together, even though, they've been saying, hey, it's coming. So there was a big push to get those weather radios out to people that live in those areas. So we do need to assess the environment just to ensure that, that things are in place so that they can be healthy, because you shouldn't be, dying because of, your home, because of some paint. If there's paint there, And we need to see what we can do, what resources are out there to come in to get even though the home is an older home, first of all, just to make sure that that paint actually has lead in it. Then if it does, what resources are out there? What programs are out there to come in and assist the people with the removal of the paint? They have radon testers. So we do know, like looking at if someone says, well, hey, our foundation is, we've been having some problems with this foundation, it's cracked, or things are unleveling, they're not safe. We've been noticing that the home or whatever is, maybe leaning, or we're having a step down, or we're stumbling when we get to this point in the home. The foundation may have tilted, or it may have, what's the word I'm looking for? I don't want to say broke, but anyways, radon is like a natural occurring thing, but it can be harmful to us if we're exposed to it in a certain amount. Also, you don't really know that you're being exposed to it until, you have those tests done and the injuries are there, because it's like odorless, you don't smell it or anything. So having those home radon tests. So assessing that environment, make sure said everything we need to say here. Okay, storing the medication. So where are they storing the medications at? If you have you're going into the home and they have a bunch of, if one child, a small child, we know little children, they're curious, those medications are not stored, away so that those children cannot get to them, then we want to point out, hey, we might need to move those medications, because the potential is there for the child getting into those medication and being harm being caused to that child. The parent might not even thought about that, not to say the child will, but the potential is there. So just identifying those things, looking at where's your, refrigerator? Can I look inside? Checking the dates of things. There are food programs out there. They have Meals on Wheels. The local community centers, I know a bunch of them, they have it where people can come to the community center, and also if they can't actually get there, they have someone to bring the meals to them. Therefore, they're having fresh food. And they also provide some resources in the different communities. They provide like these food vouchers, just making people aware of those resources that are out there. Okay, let's see here. Feel free to add in. So we talked about remember that triad, the agent, the host, and the environment, that good old antigen. But isn't something how we're made, if we're being exposed to something, our body automatically creates like an antibody to help fight it off. But remember the antigens, it could be, it's that bacteria, that virus, it's that thing, that invader that's not supposed to be there. All right, we want to break the chain of infection. We want to teach washing those hands, keeping that distance, covering that mouth when you're coughing or sneezing, to help break that chain of infection. Here's another one on the triangle, the agent, the host, and the environment. So what is the host? Tell me, what do you recall about what the host is?
Isn't that the person like that it's within? Because isn't the agent like the chemical, and then the host is where it's like, I guess developing within like the person or whatever.
Okay, what about the environment?
I guess that could be like, could that be more so like their area where they live at, maybe the group of people that's in that area per se?
That area.
Is that right?
It could be the area, it could be that restaurant, that place that, is like the where. Exactly. So that is correct. The agent, the host, and the environment. Okay. And so we went over different diseases, that cholera. What do you remember about cholera?
It's in water, the water, like pollution or of the water. And it happens after like, was it like disasters and stuff like that?
So
like,
yes. Yeah, go ahead, I'm sorry.
No, I was just saying it happens like after disasters, maybe like a hurricane or something like that.
Exactly. And that's mostly when these infectious diseases actually occur because our norm is not there. You know, we don't, for the most part, there's a national disaster or, you know, like a tornado has come through or some type of major storm. The norm, you know, the running water, the electricity. So we can't cook things, you know, at the appropriate temperature. We can't wash our hands. So for the most part, all of these infectious agents, they come about partly, mostly so because of those natural disasters, because the norm, the like I said, the washings of the hands and, you know, cooking things at appropriate temperatures they're not there. So we do have immunizations available for, you know, a large number of disease processes. Was it the, smallpox? That's the one that has been eradicated. There was another one, I don't think we talked about that one though, that was almost there, but the smallpox is one, I don't even think they really even give that vaccination anymore because we have that immunity to it. But there are immunizations out there, and part of your teaching to the community, you know, your elderly has certain immunizations that they're promoting because some are not advised until that age. Our school age children, they're advised different immunizations. So just think about those different immunizations for those specific age groups. You know, not that we're anti-vaxxers or for vaccines, but we just provide the information for the participant, the patient, and we let them make that decision. And many times as a school nurse, a lot of times the health department, they will partner with you and either to provide the flu vaccines, what's the other one that they come and provide? The flu vaccines, the pneumonia vaccines. So you're the school nurse, you're kind of the one that will coordinate that for the staff. And sometimes they also will set up clinics for the students. I can remember, and I've already shared this, I want to say maybe 10 years ago, I want to say the students were in the 6th grade at that time. You know how they always gathering data and the scientists are always looking at different things. And so they decided, hey, this age group needed a booster for if I'm not mistaken, it was either the Tdap or the MMR. It was one of them. And
We did
so
the MMR at my school in 7th grade.
so, okay, so you know what I'm talking, yes, and so they looked at it and it was like, hey, it's this set of students, they need this booster. So I know in our state, they partnered with the school nurses, and of course they had to have the parents' permission, but they came to school and, you know, what better place to go? That's not inconvenience the parent. Of course, we have to have their permission to administer it, but that's what they did. So they partnered with the school nurses and they coordinated that. So just think about your age groups and which vaccines would be appropriate for that. And another thing with the staff, with the school nursing, some insurances require these different things. And so that was one of the things that if you subscribe to that school's insurance, then you didn't have to get it, but they strongly encourage you to get the flu vaccine and that pneumonia vaccine. And so, you know, it was coordinated so staff wouldn't have to take off work to go get those things. So just be thinking about that. And so we do know when you go to the doctor's office or the ER, the urgent care, and they administer you medication of any sort, you know, they have to observe you for that time frame afterwards. You know, they have to come in and check on you just to make sure that you're not having that reaction. And these are just pictures of some reactions that people might have. And so there's a reporting system for those adverse events. And it's voluntary, but it is out there, vaccine adverse events reporting system. So just know that that is available. Now, if in the event that who's ever monitoring this, they see that there is an uptake of reporting of adverse events after a certain, you know, vaccine, then then they will turn on the bells and whistles or alert whoever they need to say, hey, we need to go look at this, because even though this is a voluntary system, we have a lot of people saying, their patients received this vaccination and they had this response to it. So then they will go back and look and see, well, hey, is it the vaccine itself? Is it the handling of the vaccine, the storage of the vaccine? Was it all at one place? They become those little detectives and try to find out, what's really going on. But it's a voluntary system. So we know incubation periods, what is the incubation time for any disease? We have several listed on the screen, but what is incubation?
That's a time that it is sitting, I guess, and this kind of before the symptoms kind of show itself. And I don't remember, I think, is it like 2 weeks?
It
Or
just depends on the disease. It
Okay.
depends on the disease process. And you're right, that little it's like kind of baking, like how you would put the pie in the oven or the cake in the oven is baking. We know it's in there. Well, at this point, a person really doesn't know that they're infected, but it's there. And it's that time before those symptoms actually show up. So that's what that is. And that's how, someone, they'll find out that, they were all at a gathering and this person was ill, but then, they then was like, well, I'm okay. And then 4 days later, or 3 days later, that person has the flu, because you have that little time frame where you show no symptoms, but you actually are infected. In the disease process, they do have different time frames, variations. We talked about SARS. SARS first emerged in China back in 2002, hadn't been all that long ago. And of course, it is known for, as a result of that, the SARS virus, respiratory illness. COVID, it's in the distant, it's still in the future, it's still here. So COVID, we all are aware of that, and it's a respiratory in that SARS family as well. And now, what season are we up on now? It's good old September, getting to be October, November. So here we go again with some more vaccinations, getting ready to be that flu season. So I know people are starting to get that, getting their flu vaccines, and I don't know if they're recommending people to get those and the COVID vaccine at the same time. I'm not really sure. Have you all heard?
You can get
Yeah,
them at the same time.
save yourself a trip.
Okay. And I do know they announced the other day that they have the new COVID booster that's been upgraded, or that has the that fights off what was
The Omicron variant.
Omicron, yes.
Yeah. So they announced that the other day. So yeah.
Just got our shipment in. We're waiting to get the actual, I guess we have to wait for a code and stuff to put in, but we'll be giving that out soon.
Okay. Because before the other day, if you were not a certain age, you couldn't get that second booster. But now they're saying that with this new vaccine on the market or available, that the age isn't a requirement, so you can get it if you want it. That's my understanding of it. So, okay, and so this slide right here is just showing us the disease process, pneumonia, and this person has mild cardiomegaly, so the heart is just slightly enlarged. And then the right middle lobe consolidation, so it does have, of the lung, has some fluid in it. And that's all that is showing. And it says this person, spleen is not there. And we do know the spleen helps with what? To help fight off?
Immunity.
Immunity.
It helps with immunity. So just thinks again, remember, you're not learning new information. You have more information than the average bear. If we were to line up a room with file cabinets, we would have file cabinets stacked on top of file cabinets. So you have that information from med-surg, from Peds, from OB. These are your same patients. They are just stable, but they're back in the community. They're at home. They're at the community center. They're at the church. So these are the same disease processes, and just bring that information on over and just identify those resources that they that are available in their community. So we do know, this slide right here is just showing us, I'm sure you all have administered the TB skin test, the PPDs, and then the people come back to check it out, to see, hey, was I responsive or not? And so we do, do we measure the redness or the induration, the raised part, when we're measuring to see if the test was
Duration.
Okay.
Duration. I give them all the.
Yes. So we measure that raised part, not the redness. So are you all, and it's been back and forth. Some places require the 2-step and some require just the 1-step. What are you all seeing? Are they requiring the 2-step now mostly, or what?
Mostly the 2-step.
The 2-step, so, okay. And then if they're finding that the test, people are reactive to the tuberculin, so the next time they have to do chest x-rays. You don't give them that TB skin test anymore. They go and do the chest x-rays yearly. So I do remember one of the test questions. It was asking about secondary intervention, if I'm not incorrect. Which one of the answer choices was a secondary intervention? So the answer choices went something like, the people were encouraged to get TB skin tests. And another answer choice was the staff was required to get the TB skin test or the chest x-ray. So which one of those would be, and I don't know exactly that it was worded exactly like that, but which one of those would be secondary prevention?
Second one.
The one with the chest x-ray, because that means they already had a reaction to the turbulence.
Yeah. Second.
Secondary, it will be the one the community have to take it just to see the risk, because patients are already they have, it will be tertiary, right?
Okay, let me reword my answer choices. I think I mixed it up. So here we go. So you are identifying the secondary prevention. So the first answer choice is the community was informed about getting a TB skin test. The second answer choice was the staff was required to get a TB skin test. So which one is secondary?
The staff's require. Probably the requirement,
formed
because
one?
the other one is more of a
Well, it could be education though.
it's not something being, yeah.
It's primary. The first one.
Yeah, it is primary, the second one.
Because remember, we said secondary, you're trying to detect, you're trying to see if there is something wrong. So yes.
First one was primary.
Was primary, exactly. We just told them about something, and so be careful when you're reading those, making the selection with those different levels, primary, secondary, and tertiary. Go back to what you know. If it's tertiary, is there a disease process already in place? Or is there something already wrong? Obesity, a broken leg, tuberculosis. Is there something else, a disease process or something wrong already in place? Secondary, we're just trying to detect to see if. So the word that made that secondary is it was required. So we're detecting. So just providing them that information didn't mean that they were going to actually do it. We just told them about it. So that was primary. So you all were correct on that. So the next couple of slides, we talk about the Zika virus. So just remember which disease process affects which population mostly. So with the Zika virus, which population of people are we mostly focused on?
New people.
What kind of people?
Completely brand new people.
Immigrants.
You saying a baby? Is that what you're saying, new?
Immigrants.
Like a baby.
Okay. Okay, I never heard them referred to as that, but that's correct. You're right, new people, the babies. And what else did you say? Someone else?
Immigrants from other countries.
And I heard someone else say something else, but it was all said together. So don't forget about who just had the new people. The moms that are pregnant, the pregnant ladies, the ladies, the moms, the pregnant women. Make sure that, so think about when you think about the disease process, who are we mostly focused on? Because who is mostly affected by it? So just think about that. So we have several of these diseases that the vector or the, what's the A word that's part of the triangle?
Agent.
Yes, the agent, and then think about the environment, and then who the host is. So just think about this when you're looking at the different disease processes. The mosquitoes, the dengue, the Zika, the Lyme, we have the tick. So if the question asks you, well, hey, which group of people would most likely be affected by Lyme disease? Answer choice A is a group of students that went hiking. Answer choice B, a group of students that went to the beach. Which answer choice would you pick?
Hiking.
A.
Okay. Yes, because more than likely, not to say that ticks can't be at the beach, but more than likely that environment is not too friendly for ticks. So just think about that. And then we have the Rocky Mountain fever as well. And this one right here, this word is always is a tongue twister for me, but it's ehrlichiosis. So this just a tick. These ticks, these mosquitoes are infected with these different bacteria. And if you get bit by one, then there you go. So just remember those. So the next slide, I have what? And so we do know that there's a STD or STI that's back on the rise. And which one is it? Because I know they have billboards.
Syphilis.
Yes, they have billboards and things everywhere. So,
I've given so many penicillin injections this past month. It's unbelievable.
yes.
It's believable.
Oh God. And those are the worst to give too. It's so thick. Ugh. And it's hard to push. And then they look at you like, why are you giving it to me in my butt? I'm like, you don't want it anywhere else.
I know. Yes. So just think about, the in the event that someone's being exposed to, if a behavior exposes them to blood or body fluids, then the potential is there to be infected by something. So, but yes, that for some reason, syphilis is on the rise. Like I said, I saw a huge billboard that was the Alabama Department of Public Health had put up, and they was just telling people, just making people aware of it. So that was the primary prevention. They had that billboard up. But then they were saying, hey, if you needed assistance or had questions or need to be tested or whatever, they have the number for them to call. So then that kind of flipped into a secondary, because they could make the phone call, then they bring them in, they test them, they're detecting. Then if they give the medication, like Ms. Barbara just said, hey, now it's tertiary, a person has, so just think it through like that. Can't get away from those levels of prevention. All right, so community assessment. EcoMap, we are looking at the person and all the connections. What is the nurse's role? We are looking at everything, the income, the risk behaviors, the finances, everything. This next slide goes into a little bit more. So we're looking at infrastructure, community leadership, economic opportunity, spirituality. And we kind of leave that one off. But we are looking at all, we can't leave not one stone not turned. We have to think of it all. All right, so again, we are still dealing with our same people that were in peds, in med-surg, OB, they're at the house or they're at the community center. I keep saying that same thing over and over again. But just remember that same information. If the person, I think they still do the screenings in the schools for the, what's the screening that they do for the curve, the
Scoliosis.
I think they still do that one. The one for lice, I don't think they really do much anymore in the school settings. What are you all? Are they still doing the lice assessments in the school, you all?
My kids all had lice and I never heard about it from the teachers. So I don't know. Somebody who worked as a school nurse said that they don't allow them to do that anymore because it hurts the kids' feelings so bad or something.
Okay. And then I know the scoliosis screen, it was kind of getting a little controversial too, because you do have to expose a body part, in order for that.
It should be done at their well child check anyways. That's how my daughter's was found at her
Mhm.
well check.
So another thing, another task, and it's not all school nurses, but they were partnering with the Alabama Departments of Public Health. They were partnering with the Children's Hospital, and that was one of the screenings that they kind of were trying to, I guess, be proactive. So, if you all go ahead and screen the children, then, you tell the parents to contact us, and we'll, take it up from there. So, but I know it kind of, was getting a little sticky. My child is saying they're having to raise their shirt, and the PE teacher would usually do it. The school nurse would usually, partner with the PE teacher. And that's how it would be done during that time, because, they did have to change clothes for PE, physical education.
Well,
So-
it was also done when the kids were going through puberty, so
Mhm.
it was very uncomfortable.
Yeah, uncomfortable. So yes, I'm not even sure if they're still doing that anymore. But we do know that these are some screenings. If they come for their well child check, then that's something that will be done during that time. So we do know we have the little outbreaks, and if you're that school nurse in that setting, you do have those little outbreaks of the stomach ache, the pink eye, the conjunctivitis. The stomach aches it could really be a stomach ache, or it could just be nerves about they didn't really study for an exam. It could be nerves about what's going on with them and their friends. So, but if a child, what's that one thing that we can do if they have that vital sign is if it's, increased or raised or high, more than likely there is something going on with their stomach. What's that vital sign begins with the F? We check their, begins with a T, I'm sorry. I'm saying what it is. We check the temperature, and if they have a fever, that is a sure sign that something is going on when they're talking about they have a stomach ache. Because stomach ache is one of those ones that's kind of iffy, it could be really due to a bunch of different things that really isn't a stomach ache. But if that child, you check that temperature and there is a fever, something is going on. Okay, and so we do remember those disease processes, those chronic heart disease, hypertension. Which disease process do we see this symptom of the skin?
Diabetes.
Cushing's?
Diabetes.
Diabetes.
Mhm. That's one of those symptoms that you will see. It's like that thickening of the skin. And that is one that would be there. So remember our population, we have our elderly, we have our babies and our teens. So just remember that they all, anything can happen in any age group, but the different age groups have an increased risk with certain things. So for our teens, we know, they're growing and, they're experiencing things or trying to experience things. They're curious about things. So we have to teach about wearing those seat belts or learning how to drive. They're getting those driver's license and they're in those vehicles by themselves. They're getting the new phones. And so just think about all those things, those behaviors that will put them at risk to cause harm to themselves or others. So those are things that we will be teaching about. Yep, just another image about safety. Okay. So we do know with the different disease processes, we do have to provide different teaching depending on that disease process. So a person that has kidney disease, what kind of diet would we want to encourage for a person that has kidney disease?
High protein.
Yeah,
Low
low
sodium.
salt.
Okay. What about someone that has diabetes?
High fiber.
Low carb.
Okay. What about someone that has congestive heart failure?
Left
Ash.
side.
Congestive heart failure. Did you all say low sodium? I think that's what I heard you all say. Okay.
Yes, low sodium.
Yes. So just
Heart
because
healthy diet.
heart healthy diets. So don't remember the disease process, and you're bringing them, they're not acute, you're bringing them to the community. You're trying to provide information so that they can have the best quality of life, so they can prevent that disease from getting any worse, preserve the quality, the condition preserved so that it doesn't progress or get worse. So you are that go-to person. You're identifying those resources that are there and you're help coordinating. And so I think one of the test questions here on this last exam was about, you were talking with a case manager and your patient had congestive heart failure. You know, which one of the following would be most important or would be priority? So remember, when you're taking those tests, you want to dissect, understand what is the question really talking about. You know, what is it really asking you? You know, you have this whole huge scenario, but what is the question really asking you? If the question is asking you, what would be an assessment finding, when you look at the answer choices and 3 of them are about an outcome, are you going to select those? Because the question asked you about, now it might be some great outcomes, but the question asked you about an assessment. So don't get tripped up about that, you know, with that. Look and identify, well, what is this question really asking? What is it really asking me? And then with those priority questions, and it says, which one is priority? More than likely, every answer choice is correct. So don't get, you know, thumbed with that. But which one? Go back to good old Uncle Maslow. You know, what's the things that we need? Food, water, shelter, oxygen, ABCs. So if an answer choice has to do with ABCs, you need to select that one. You're the person that's coordinating that care. You're identifying those resources, and you might have to go over a community because some in the rural areas, remember, things are limited. That specialists might not be in that area. So you might have to identify a resource for that's in a neighboring community, in another town, that specialist, and also a resource that will provide assistance with transportation. If not with transportation, with the funds for transportation, because they have those resources out there. So just think about coordinating that care. And think about the financial, you know, every part from A to B, from A to Z. All right, what is this slide saying? Community health, we're talking about the geriatric population. So if you're going into the home, you know, you want, as I mentioned earlier, you want to make sure, you know, you want to see where they're living. You know, you want to go into the restroom to see if they have those rails, if they have the raised commodes. What about, is it okay for them to have, and I'm not against throw rugs, you all, I love them. I think there's some beautiful things, but what do we know about throw rugs and people falling, especially our elderly? Are they a good thing to have in the homes?
No,
Oh, they're tripping
they're
hazards.
trips.
Yeah, so you might just want to identify, hey, you know, you might want to, you know, put this rug in a room that you really don't frequent that often, because you can actually make you fall. You'll get stumble, your feet will get caught up in it. So just looking at those things, identifying those things that are in the environment that puts that person at risk, depending on their age group. So we're talking about the geriatrics. What else?
Usually, sorry.
Go ahead.
Usually in home care, you know, it's like I work as a CNA hospice home care, and we usually always got used to observe, you know, if the patient has a rag or they have like a oxygen, how is the nasal cannula goes, you know. We try always leave the patient taking all those high risk for fall, and moving and reporting to the nurse so she can call the family to make sure they take it away.
Okay, okay. So that's good, identifying it and then also reporting to the appropriate person. So that brings me to remember things that you can delegate. Remember, people have a scope of practice. And so remember, LPNs cannot teach, assess, or evaluate. I think that those questions have been on several of your exams. And remember, you know, certified nursing assistants, you know, they can't teach, assess, or evaluate either. So remember, so go back to people's scopes of practices and what they can do. And then identify whether or not you can delegate that task. And they can facilitate or encourage, but as far as teaching something, assessing, or evaluating, they can't. So that's good. So we identified the problem, just like Rita said, and then informed whomever that needed to know that really could do something about it. That's good.
Yeah,
So
because
these-
sometimes the patients, they don't want to take it off, you know.
Mhm.
But if the family members talk to them, you know, because we have to visit them all the time. So
Mhm.
to deal sometimes with them, it's better if the nurse says with the family or the nurse tell them than we, so we can keep really friendship.
Exactly. You're right. Look, make the nurse the bad person. But no, you have to think about that. It's like, okay, now I've identified this and I know, and that's part of providing that care for them. That's being that advocate. Yes. You identified it and you say, well, hey, I still need, because I'm the one that's coming here most of the time. And so, yes, that was good.
Yeah.
Good example. Good. So again, you know, we are faced with these disease processes. COPD, we haven't talked about that one that much, but which body system does COPD mostly deals with? We know it involves the whole body, but which body system right off?
Respiratory, lungs.
Respiratory, okay. And so, let me think of a question here. So if you are going into the home and you notice that the patient, you know, if the patient is on oxygen, they're oxygen dependent, and some are and some aren't, you know, we have all different degrees of these disease processes. But the patient says, you know, they've been having problems breathing, and so they have just been turning their oxygen up, and it's just been getting worse. So what would be some teaching or some things that you would identify that, you know, that they shouldn't be doing?
Well, they should not be turning up their oxygen for one. COPD people should not be taking oxygen more than 2 liters
Mhm.
because then they are dependent on it, and then they go into like I forget what it's called, where they can't breathe there. So I would just tell them that if they're having problems, they need to go see their family physician or their pulmonologist to get their medications looked at. Or
Good. Anybody, anyone else? And
They
you're right. Oh, I'm sorry, go ahead. Oh, that was it. Yes, and she's correct, because remember with COPDers, that increase in oxygen causes the opposite effect. So more this time, more is not better. More is actually worse for someone that has COPD. It causes like the opposite effect. So that's why they would say that they were not getting any better. They were feeling worse because they had turned the oxygen up. They increased the liters that they had it set at. Good. So
Professor, sorry to interrupt this. This is because when the patient have COPD, the gas exchange is no like as a normal, right? Because when they have the cardiac output to go back to the lungs, they have oxygenate the blood to come back again. And so if they have so much oxygen, it will be lacking the gas exchange, right?
Exactly.
Because it's too much work.
Okay. Yes, that gas exchange, the inhale of oxygen and out of the carbon dioxide, it is not happening like it should. Exactly. That's a time more is not best. You know, we think more, more would be best, but no, it causes the opposite effect. Yes.
Okay, thank you.
You're welcome. And so we, death and dying, when we know people can come off hospice, when you're on hospice, it does not mean that, it could mean death is imminent, but it doesn't have to mean that all the time. But our goal with hospice is, what's our goal with hospice? With our interventions, the main two goals.
I with
Maintain
dignity.
dignity,
Mhm. And what about that pain?
maintain pain, make sure they're comfortable.
Yeah, as comfortable as possible. Sometimes people are never pain-free, but just, as comfortable
For
as,
palliative care,
yes.
right?
Go ahead, Erica, say that again.
Oh no, I was just kind of making it all into one. So just palliative care, comfort care,
Mhm.
making sure their families don't need anything, how giving them time, things like that. Is that correct? Am I getting that right?
Yeah, so the family is a piece of that as well. They have it where the chaplain can come in and talk to the person and the family. That's part of taking care of the patient also. What's another thing that they do? Even if the person is, for example, if the person is in a long-term care facility and their insurance or the hospice is taking care of them, the CNA will come in. The nurse will still come in and take care of that person at a long-term care facility. So people can have hospice at home, but they can also have hospice inside of a nursing home too. So that is there. And also, if they're in the nursing home, just like at home, they would bring in the bed or whatever resources that they would need, the bedside commode, the adult briefs, if they had a feeding tube, the formula, the feeding pump, they would still bring all of those things to that nursing home too for that person. And I have seen people be put on hospice and be taken off of hospice because the condition improved. So hospice does not mean, all the time. Yes, the end, exactly.
And also, Professor, patients when they are in hospice, actually, to help to the families to get, burn out. We have respite. I think it's for each month or every 3 months. I think they have a week. Patients, they can go to the facility so patients can not exactly relax, but do the stuff they have to do, So the patient, I think the hospice pay at the time that the patient will be in the facility that the family choose for a week.
Thank you for bringing it up. That is a service that they provide. You're right. I knew it was something else with the family that they would do. And that is correct. So the person for that week will be, I don't know if they really call it admitted to that nursing home or that facility, but essentially that's what happened. That person is taken out of the home and taken to that that level of that skilled facility, whether or not it's a nursing home or either a long-term care facility, so that the family can, I don't want to say get some rest, but do the things that they need to do. And I forget too, I'm not sure, like you said, it's every 3 months or.
I think it's every 3 months they have a week.
Yes.
But sometimes, they don't know.
Yeah, and a lot of times families don't know that. So that's a resource that you can, inform the family about. And that is true. You're right. I knew it was something else besides the chaplain that they were bringing in. Yes. And they actually, like I said, take that patient from the home and they admit them into that facility. I don't think they really call it an admission, but they're there for that 7 days and that family can do whatever it is they need to do. And after that time frame runs out, then they go back to the home. Yes, thank you for bringing that up. Let's see, on here, we talked about, looking in the refrigerator, going in all the different places of the home, identifying those hazards. Polypharmacy. So with the polypharmacy, sometimes, especially with even blood pressure medications. Was there a question or a comment? No. or either cholesterol medications. You know, sometimes doctor changes the dose of medications, but you know, most of us, we do not throw away those medicines. So if you're going into the home and you're looking at, you ask to see the patient's medications, and you see that they have 2 medications, the same names with different doses. Is there any teaching or is there a conversation that you need to have about that?
Yes.
Oh, sorry, go ahead.
No, I'm just agreeing. Yeah, you do need to have a conversation.
I was saying, like, I was thinking like, we have to check the medications, because sometimes it's will be have a
They're
reaction
expired.
with other medications, and plus sometimes, you know, when elderly people, usually they always like to have extra over-the-counter medication, you know, to add to their pain or anything else, or sometimes they have how they say, herbal medications too, especially ladies more than men's, you know.
Mm-hmm.
But so we have to teach them, like you say,
exactly.
educate.
You do want to have that conversation. Hey, you know, you have these, you know, these meds, these are the same meds, but they're different doses. Now, which one of these are you taking now? Just to make sure that they are not double dosing, and so that they're taking the correct dose, you know, because they might, you know, sometimes people, you know, you've seen people line up all their bottles and they just go through and pop a pill out of each bottle. And if they're not really remembering, hey, the doctor stopped that one, that, so you should be on this, and it can go either way. They can increase the dose or decrease the dose. But we do want to have that conversation. Hey, you know, this one right here, you need to put an X or something on this one, or some letter, or take it out of the bag, or put it in a different box. These are your DC medications. You're no longer on these, because we do know they don't want to throw them away, but we do want to make sure that they're not double dosing and taking the wrong dose. So we do want to look at that and bring that to their attention. Okay. We talked about hospice nursing. What about faith-based nursing? What settings mostly would you, is the faith-based or the parish nurse, what setting would he or she be in? Well, they call it too a congregational nurse. So what settings would they mostly be in?
Could they be
Usually
in a
people's
setting like
homes, yeah.
Specific to their
or-
culture or their religion.
Okay,
Right.
say that again.
Like they're gonna be focused primarily on specific to their religion at home, not necessarily like in a facility.
So it's specific religious, it's religious focus is what you're saying, yes.
Yes.
So it may be a church, a chapel, it may be the community center part of that church or that chapel, but the key thing is whatever that religion is. So it's focused on that, whatever setting for that religion. And they do have certifications out there. Like you can get a certification, you know, in pretty much in all the different areas. You can get a certification to be a diabetic certified nurse. You can be a parish nurse. Those are extra certifications and things that you can actually get. So we kind of talked about disaster. We kind of mentioned that earlier when I was speaking on the weather radios. But if a community has a disaster, you know, we have to be thinking about, you know, the response, you know, how are we going to alert the community that the disaster has occurred? How are we going to, what's our response time to, you know, responding to the disaster? What are those resources that we have available? You know, is there a Red Cross? What are some other resources that help with in the event of disasters, you all? I know the Red Cross.
FEMA,
yes.
The local churches.
Mm-hmm.
It's, how do you say, NHR or the National Resources, the one is in charge all the disasters.
Oh, national response. Okay. Yeah, I know it. Yes. Let's see. What else? Is that it? For the most, those are like our big ones. And so,
Yes.
you know, the churches, they're just, you know, they'll provide lodging, they'll provide the food, you know, they're big. They're up there almost with the Red Cross, you know, they will set up resources, you know, at the drop of a dime. So just think about those disasters. Hopefully we never ever have to endure, you know, bioterrorism, but you know, taking those, you know, like the anthrax, you know, about 10 years ago, people were receiving the letters in the mail. And so as a result of that, what would the nurse expect to be doing in the community if there was a threat of, for example, you know, a bioterrorism threat for anthrax or something? What would we expect to be
I think that's
Making
immunization,
sure immunizations.
immunizations.
Exactly. So
My
just-
husband has to get the shot every time he goes overseas. Anthrax.
Mhm. So yes, just keep thinking about that. Yes, hopefully we never ever. And as you know, these disasters, you know, we've had where the tornadoes have come through, and you know, and things have just happened, you know, the fires, and we have to go in and do the disaster triage, and they use it's color coded. So we do know the black, you know, if that is, if it's marked with, they have different things, like in a lot of kits, they have like tags, or sometimes they have like a marker or something, but something to identify those colors. So what does the red mean? Do we need to be getting those?
Immediately, they need care immediately.
So those are the people that, and when the ambulances arrive, these are the people that we want to be moving out. We want to be moving out. So what about the yellow, the people that we've marked as yellow? Do they need to be in the ambulance right away, or they can just kind of wait and we can kind of manage them there?
After all the criticals are gone, let's go to yellow.
Okay. And so though we can pretty much manage them there because their injuries are not as critical. You're right. Yes, so those are the colors that it is pretty much universal. Those are the colors that we use to identify the levels of our reactiveness. You know, we need to do something quick, fast, in a hurry. So we talked about our migrant workers. And so assessing their environment. What's the big thing that we have to keep in mind or provide education or think of resources for? Because they're being exposed to what?
Pesticides.
Pesticides. So we want to, so what's some teaching or some things that we can inform the migrant worker about in reference to their, go ahead.
Hand washing stations for them.
What about their clothing?
Oh, yeah, definitely remove those before you go in your house if you can, and wash them immediately.
Okay. So what about the musculoskeletal system?
Back problems.
Exactly. So just imagine, for the gardens that we have had, and you out there working in that garden, and that night, oh my goodness, your back, your neck, your everything. So imagine doing that on a larger scale. We're talking about acres and acres of land that they are working. And so, yes, back pain, chronic pain. Okay. So we kind of talked about this too in the rural communities, identifying those resources because they may have to travel a distance, because in many rural areas, those specialists, they're not there. There is an uptake in now where they have these, they're having they're partnering with the specialists. So on certain days of the week, they're coming to the rural areas. And so, but then what if that person cannot get off work that day, to see that specialist when they come to their area. So you will have to, like I said, you can identify other resources. They have resources that can provide the actual transportation and also the funds, the finances to kind of offset the cost of gas for them. So you can actually start some programs, some walking programs identifying areas where where it's safe to walk, safe to, have the little get-togethers and things like that. Because in many times in the rural communities, they don't have a lot of community centers and things to go to.
Call has been forwarded to an automated voice messaging.
I don't know, you all, sometimes you're, I don't know what Zoom does, but sometimes you'll come off of mute for some reason, but anywho, I got you. I clicked you back on mute. So, substance abuse, which population of people or age groups rather, we mostly see substance abuse in?
Probably like what, the mid-20s?
So they're, growing up, trying to test the waters, as they say. Yes, and what other populations we might, it's not all, but we might see.
Older adult,
Okay, and what other populations?
adolescent,
Yes, and what other population?
The teens?
Middle age?
Poverty.
So we identified the teens. What about the homeless population? What about the mentally ill? Because sometimes those resources, a person that hadn't been diagnosed don't have the resources to maintain or to cope with their mental illness. They don't know what it is and what to do about it. Sometimes they turn to the substance to help deal with whatever. And then as a result of it not getting better, or them not being able to cope and still not knowing that it is a mental illness that they're dealing with, they continue to use more and more substances, and so therefore they end up abusing it. So the homeless population, sometimes, people get down in the dumps about their situation, and for some reason, drugs are available, and so there you go. So just think about those populations and the different resources that we can identify. The mental health services that are in the community, the case managers, how can we coordinate, a place, a halfway house or rehab for those people to go to. They have several programs for adolescents. They have a lot of programs. And comparing to like the older population. For the most part, the older populations, they have to pay out of pocket from my experience. Now for the adolescents, they're still covered for the most part under their parents' insurance. So those resources are more readily available for them in reference to substance abuse. So think about our homeless population, you're like, what are they being exposed to? So, what is their environment? So think about those things that, their exposure risk, and what can we do about that? If there's a homeless shelter in the neighborhood, how can that person go about, because sometimes it's just not knowing, how can they get a bed? If they need to be there by a certain, because I know some of the shelters, you have to be in line by a certain time. So providing that information to that person, hey, you can at least have a bed or warm place to stay, but you have to be at this place by this time. And that will help. So we do know abuse can occur during any age group, in any age group, abuse can occur. So just, be looking out for those signs of abuse. And we are, as healthcare workers, we are what kind of reporters?
Mandated.
Exactly. You don't have to do the investigation, but if you think abuse is going on, we're mandated reporters. We have to report it. Now, do you have to tell who you are and all of that when you call to report it? No, you're not. You don't have to. So abuse does occur, no matter what. It could occur no matter what the age group. So mental illness. And so just think about when we're communicating, is our communication therapeutic or non-therapeutic? They say be careful with the why questions, be careful with the, our wording, the way we word things, because we want to establish that rapport and have that openness so that our patients, our community members can open up, so we can find out what's really going on, so we can identify those resources that are available and might be beneficial for them. So just think about that. So we want to always consider the culture. We want to identify our own biases and our own likes and dislikes, and then try to put them to the side so that we can take care of our patients. So we have to consider, cultural differences and the sensitivities of each culture. Some cultures, they don't like to be touched. Some cultures is okay to, do the touching and have the eye contact. And some it isn't.
I encountered that today.
Please share.
My husband is Hispanic, and some guy at work made a joke about sleeping with his wife, and my husband got so offended. And I had to sit him down and be like, the guy genuinely thought he was telling a really funny joke. But in Hispanic culture, you don't joke about people's moms, you don't joke about people's wives, you don't joke about people's daughters. Not done.
True.
Yeah, and the children, they tell the mama jokes, but you're right. You just don't.
You don't do that with Hispanics.
You just
Yeah, we
don't.
say you don't do. I mean, you can do whatever as long as you don't touch my mom.
Mhm.
It's very
In
offensive.
Franklin's case, he got so offended. I was like, it's okay, dude. He was just joking.
Yes, so be sure to bring to your remembrance, hey, when you're dealing with people from different cultures, but hey, those things that are acceptable and those that are not. So we do have notes here. The Native American are often past oriented, so they may not be concerned about the future. And so when you're instructing that client to call in 3 weeks for a follow-up appointment, you might have to, in fact, follow up with them to remind them, well, hey, I told you this, to call and make that appointment. I'm calling again just to make sure you make that appointment, because more than likely they probably didn't, even much thought about it, because, that's just not something that they focus on. So you would have to provide assistance with actually scheduling that appointment. So just consider that. And that brings us to the end of this presentation. And I will, as soon as this converts, it'll be made available and sent out to Dr. Lundy, and then they'll post them out to all the classrooms. Complete let me put these instructions in the chat here. So you should type your name, your campus in the chat, and your professor. Go ahead. So type your name, campus, and your professor's name in the chat. Complete your attestation. You can go ahead and you're being given time now to do that. Go to your assigned class, and in the wording, the information that you have to input, put today's date and your professor's name in your attestation so you can get that completed, because they still want that done for your attendance.